Hello, guys. Happy hump day. I hope you are having a good week so far. So, I know if you've been watching a lot of the previous lives that we've been doing, you saw Paul do an enlighten peel. You've seen Lindsay talk about skincare. Well, I'm going to change it up a little bit today. I'm going to be talking about anti aging in terms of laser treatment and how skincare can impact the results of that. Hi guys, I'm so glad to be back. If you didn't catch the very beginning, I hope everyone had a great week so far. We're halfway through. We're about 2 days away from the weekend. Yay. But today I really want to focus on lasers. So working at, Dr. Emer's practice, one of the main things that we do is laser treatment. This is a great way to get anti-aging results, and it's a different anti-aging aspect in terms of peels versus lasers. So I know we've been talking about peels. I tell people it's the car wash effect. It's great for superficial pigmentation and texture. It's great to get a really good rejuvenation. But if we're talking about actual internal anti-aging impacting the skin and really getting some good collagen production, that's where we really turn to the lasers. So I'm not sure how much you guys know about lasers, but in a very quick play on how lasers work, we introduce heat into the skin. So we are damaging the skin in a controlled way to where it induces a collagen reaction. So whenever we hurt the skin, even if we cut our skin, if we burn our skin, the way that our skin heals is by producing collagen. Well, these lasers burn the skin in a way that when the skin repairs itself, it actually adds some anti-aging. So if you're younger, if you're like me, I'm going to be turning 29 here soon. For me, I would be put on a very general laser maintenance. And this is where I would be doing lasers every 6 weeks, every 8 weeks, and I would continue that. Now, whenever I talk to patients in our practice, a lot of people have the misconception that lasers are a one and done deal, and that is not the case. It's kind of like telling somebody, hey, go to the personal trainer once, and you're going to get the abs you've always wanted. Nothing in life works that way, or at least not yet, not until we get some more advancements. But with lasers, you really want to work up to that. You want to do lasers continuously. If you did one laser and you're like, it didn't do anything, you didn't give the laser a chance. Now, if you did a strong laser like a CO2 or an erbium or a profractional or even a Fraxel, yes, you can see results after one treatment. But if you really want true anti-aging in terms of lasers, you do have to be put on a maintenance plan to where you do the Fraxel, twice a year, and then you do clear and brilliant lasers in between the Fraxel to kind of maintain the results. It's just like going to the gym. It's just like dieting. It's something you have to commit to. It's something that you have to have the right knowledge. And it's also, you have to go to the right provider so they put you on the right treatment plan for your skin. Because what lasers would work for me won't work for someone who is 20 years older than me, or the same lasers won't work on someone who has a different skin tone than me. There's a lot of different factors, there's a lot of different settings, so that's where it's really important that you go to the right doctor for your skin. And this is for anti-aging, this is for acne scarring, whatever specific concern you have, different lasers will impact your skin in a different way. Let's see, did I miss any questions? We're, I'm hoping the quarantine's lifted soon. We'll see. Let's see. What age should I start getting these treatments? Okay, so actually this brings up a great point. A lot of my clients, if they're younger, if they're, 25 to 30, they're like, "Well, I'm not really showing signs of aging yet, so I don't want to start." Well, that's absolutely wrong. You should start before you see the signs. Because if you start after you see it, you have to be more aggressive, and then sometimes you've waited too long, and then you actually have to do something more surgical to get the results that you want. But if you start young, it's called prevention. So the more lasers that you do younger, if you get put on a maintenance plan, you're going to age very gracefully and you're going to age less quickly than your counterparts that are not doing laser treatments. Now, if you're already older, that's totally fine. We just have to be a little bit more aggressive in the beginning with some stronger lasers, stronger chemical peels, and really aggressive with the skincare, and then we can put you on a maintenance plan. What is the best treatment for dark circles? So we get this a lot. As you can see, I still have a little bit of dark circles myself. There's really several things that you can do to combat the dark circles. There's no one treatment's going to fix it all. I have a lot of my patients actually derma roll underneath the eyes to really start helping with collagen production, to help with those little wrinkles, and it will also help with the dark circles. Another thing that you can do for the under eyes is filler. So filler kind of really only covers the issue and helps it. So Dr. Emer has a protocol to where when he does fillers underneath the eyes, he'll actually do fillers in the cheek. What this does is the fillers in the cheek create a little bit of foundation for the under eye filler, so your under eyes don't look as puffy. That is something that can happen, but that's Dr. Emer's way around it. Because if you've ever done under eye filler and you didn't support it with that cheek filler, the under eye filler can look puffy in certain people. So definitely keep that in mind. Let's see. Is that for people who smoke, they have some serious skin issues? So, yes and no. So, smoking obviously it just ages you much more quickly than other things. It's just like the sun. So, if you are a smoker, you're going to notice fine lines are going to show up quicker. Your collagen production is going to go down. Most people, like the reason why kids look so young is because their collagen production is just ramped up and it's really going. But after you turn about the age of like 16, 17 into your 20s, guess what? Our collagen production has slowed down. And that's where we really start to see aging. But that's why the lasers are so important. Those lasers will jumpstart your collagen production so you can keep your youthfulness for a little bit longer, and you're going to age much more gracefully. The fine lines aren't going to show up as quickly. You can do stronger lasers around the eyes while you do a much lighter laser on the rest of the face. And this is really important because when you have a discussion with people, where is the first place that you look? You look at people's eyes. And unfortunately, one of the areas where we age the quickest is around our eyes because the skin is so thin and soft, and also on our neck. That is another area that really can give away your age. Even if you're taking care of your face with skincare and everything, you need to make sure that you're actually taking care of your neck as well. All right, I have friends same age who are out in the sun and smoked and their skin looks very aged. What lasers are good for those people? So without actually seeing them, I don't know exactly what lasers would be best for them. It's very hard to tell someone what treatments that they need without really seeing their skin. However, I'm just going to kind of make assumptions. If your friends are Caucasian, what we would do is we would start them off with a chemical peel, kind of like the Cosmetic and the Enlighten peel. We've been talking about those peels a lot. They're great for sun damage because a lot of the sun damage, it's beneath the skin, but it's also on top of the skin in forms of pigmentation, just overall uneven tone. The chemical peels are going to help even out the tone and lift a lot of that sun damage. Now, if they're my skin type, they have lighter eyes, they have light hair, I don't produce that much melanin, then I would suggest that they do a Fraxel laser. However, Fraxel is known for creating post-inflammatory hyperpigmentation. You can Google that if you want, but that's where lasers can produce a certain type of pigmentation in skin, and that's why it's really important that you go to the right doctor. Because if you go to the right doctor that really knows the lasers, they will know what laser can be safely done on your skin, especially if you're on the darker side. If you're Asian, if you're Latino, if you're African American, your skin produces a little bit more melanin, which means we have to be super careful with what lasers we can do on your skin. Now, one laser that everyone can do, I don't care what your skin tone is, it's called the Clear and Brilliant laser. I call it the laser facial. It's very light, it's non-ablative, it doesn't break the skin, the downtime is very minimal. It's about maybe 3 to 4 days of downtime, though most of my patients only experience mild redness for about 2 days. It's a superficial laser, but it is great for inducing collagen production. It's great for younger people, but this is a laser that if you really want the full benefits of, you're going to do it at least every month, every 2 months. You need to put yourself again on that maintenance routine. Because if you just do like 2 Clear and Brilliants and then wait a year, you've missed out on more collagen production. So you're not really getting the true anti-aging that a laser can provide. What are good lasers for the eyes and the neck? So again, this is where every laser is not going to work for everybody. So if you are on the darker side for skin tones, then what we would have to do is we would have to prep your skin with a chemical peel. So again, the Enlightens and the Cosblondes we've been talking about this entire time, they are great pigment suppressors. So if a person with a skin type 3, 4, or 5 comes into our office and they want to do a laser treatment for a specific concern, we pre-treat their skin using chemical peels, using skincare before we even go to the laser treatment. This is the best way to protect their skin. You're still going to get anti-aging results from that. And then when Dr. Emer does the laser treatment, he can actually be a little bit more aggressive because you have prepped your skin. You're keeping your skin safe from these lasers. The estimate for high definition liposuction for men for the abdomen and the chest. So definitely DM us. We can kind of give you a rough estimate. However, to really get a true cost breakdown of what surgery would be for you, unfortunately, you would have to do a consultation because everybody's body is incredibly different. So it's very hard to do a quote unquote estimation because some people need skin removal and some people don't. And that is a huge cost difference. Let's see. So the best for raised scars, it really depends on if it's a keloid scar. Is it scarring caused from, previous surgery? Is it acne scarring? So again, I mean, there's so many different lasers on the market. I know at our practice with Dr. Emer, we probably have a good 40 lasers that we use for very specific reasons. And so it's really hard to tell you which laser would be good for it without actually seeing the skin. What type of lasers that produce collagen? So almost all the lasers that you're going to do at our office will induce collagen production. There's really two main types of lasers. There are ablative lasers and then non-ablative lasers. And the main difference is ablative lasers, just in very general scheme of things, really burn off the top layer of skin and they can go really deep. That's where it's looked like, you've walked on the surface of the sun. It's very aggressive. However, ablative lasers give great anti-aging results for people that have acne scarring, for people that are a little bit older, because we do have to be a little bit more aggressive with the lasers that we use in order to get a good outcome. So non-ablative lasers, I think the most famous one that most people bring up is going to be the Fraxel. So specifically the dual Fraxel, which is the one that we have in our office. It's great because it can be more of a superficial non-ablative laser, but it also has a deeper setting to where you can get more collagen production underneath, which is going to tighten the skin a little bit more. So it really depends on what concerns that you have, but all non-ablative and ablative lasers are going to induce that collagen production. All right. Let's see. May you talk about stem cells? Okay, so I can go more to the skincare side because I already kind of covered a lot with the lasers. So skincare is really important, and this is the metaphor that I like to use. So skincare is like dieting. If you're going to go to the gym and you're going to get a trainer and you're going to work out several days a week, you need to go home to diet to really get the full results of that workout. And that's exactly what skincare is. If you're going to a doctor, if you're going to an esthetician and you're doing peels, you're doing lasers, you're doing, any type of aesthetic service to your face, the most important thing is skincare. Skincare is going to help you get results at home. It's going to help you maintain the results, and it's also going to help protect your skin. So if any of you have ever done a chemical peel or a laser peel with Dr. Emer, you know that we have very specific protocols to follow. So if you're doing a Cosmetic peel, it's very aggressive. It can be very uncomfortable. However, if you have the skincare that we recommend, it really changes the outcome. You're going to be much more comfortable during the peeling process. Your skin is going to heal quicker. And then also it's going to help maintain the results after the peel. And it's the same thing with lasers. If you're going to invest in lasers, do skincare at home. The more skincare you do at home, the better the lasers are going to perform on your skin, the more anti-aging you're going to get. Now, if you want to do a step further, this is where you start derma rolling at home. So derma rolling is a great way to induce more collagen. So I derma roll once a week. I'm going to be making a video here very shortly. I might even do it on a live one day so you guys can watch. But I derma roll once a week. It gets that collagen production going in my skin, which is what I want. It really helps with pore size. It helps with fine lines. It's going to help with wrinkles if you're consistent. But that's one of the most important things, is that collagen production, because as we age, our skin stops producing collagen, and that's what causes our skin to start to sag, start to lose volume. It causes a lot of things. So I can't even say collagen enough. Collagen production, collagen production, collagen production. The more collagen production you have, the more anti-aging and the more youthful you're going to look. Is it true that PRP doesn't give good results on a smoker's skin? So I don't know exactly what you're asking. However, PRP, if you guys don't know, is something called platelet-rich plasma. This is where we draw your blood, we put your blood in a centrifuge, and it spins around and it separates your white blood cells from your platelets. Those platelets are your own growth factor. So PRP, it is good for anti-aging, it's great for healing, and it's really good for giving your skin some glow. We use PRP specifically for healing purposes. So if you get a really strong laser done, like a Fraxel, an erbium, a CO2, PRP is a great treatment to pair at the same time as these lasers, because it is going to aid in the healing process so you heal faster. Would you recommend RF among normal microneedling? Okay, so let's jump to microneedling. So this is kind of like derma rolling at home, but it is done by either a PA or a dermatologist. There are two forms of microneedling. There is normal microneedling, which everyone is very familiar with, but then there's also radio frequency microneedling. So this is something like Fractora, Morpheus, Intensive. So what these do, it's microneedling with I can't even talk right now. It is microneedling with radio frequency energy. So it's microneedling on steroids. Most, like I know for the Fractora and the Morpheus, if you do that type of radio frequency microneedling, you're going to get textural improvement. You're going to get collagen production, and you're also going to get tightening. You're going to get skin tightening. It's one of the few lasers where I've actually seen visible tightening even after one treatment. Now again, everyone is different, but I have seen patients get results after the first round. So that's really the main difference. If you just do regular microneedling with PRP, then that's something that I would want you to do every month and a half, to continue that collagen production and to really get the main benefits. If you do microneedling once every 4 months, it's like going to the gym once a month. It's great that you're doing it, but you should be doing it more. Let's see, I'm seeing if I've missed anything. All right, I don't think I've missed anything. Sorry guys, there's been a lot of comments. Let's see, are there any other questions that you have in terms generally about lasers? And I wish I could be more specific with what lasers would be good for your skin, but if you are interested in laser treatment, if you are interested in kind of knowing, well, I'm interested, but I don't know where to begin, I don't even know where to research, get that consultation with Dr. Emer. He can really lead you in the right direction. He can give you a good idea what lasers are good for your skin, what lasers he would do on your skin, which I highly recommend going to Dr. Emer. He knows these lasers inside and out. He had several residencies with these lasers. I'm kind of jumping off topic, but I have a lot of patients that come to us because they've been damaged by lasers in the past. And there's a lot of providers out there that don't necessarily understand the lasers and understand the skin. So I always tell people, the way that I would drive your car would be different than the way that you drive your car. Even though it's the exact same car, it is the same pedals, it's the same button, it's the same engine, but I would still drive it differently than you. And it's the exact same way with lasers. If you do a Fraxel laser with two different doctors, you're going to get two different results because there are so many settings on these lasers that need to be set to specific settings for that person's skin. So that's why it's really important to go to an experienced dermatologist, because they will look at your skin and they will know A, which lasers your skin can tolerate, and B, what settings the lasers need to be at. So even though you've had one bad laser treatment and you think lasers will never work on your skin, that is absolutely not true. You just did not go to the right provider for that laser or for your skin concern. What laser works best for linear scars? So I'm again, if it is a scar and if it is maybe slightly raised or if it's just a colored scar, it really depends. We like to use a lot of vascular lasers for new scars because there is some type of redness that is causing the scar to be more apparent. And we do like to use the Fraxel laser. Now, again, the Fraxel laser can induce pigment if you don't prep your skin. So if someone with a darker skin tone comes in and they have a scar, they really want to fix it, we're actually going to prep their skin with skincare, a chemical peel, and then a week to 2 weeks later, that is when we perform the first laser treatment. Now, depending on the scar, you're going to have to do several treatments to really get a good outcome because, again, there is no one and done when it comes to lasers, excuse me. And if you do have a concern that is a one and done, I would consider yourself very lucky. How much is a laser session for a full face? So it really depends on what you need. Some of our lower end lasers, they are around $400 a session, and they can go upwards to the most powerful lasers that we have can be a couple $1,000s. So again, it's really different. It just really depends on what your concerns are, what your skin tone is, what you've done in the past. There's a lot of factors. Can Morpheus give similar results to a laser? Well, it really depends on what your concern is. If you're looking for skin tightening, Morpheus is a great laser to do. If you're looking for more color and tone, Morpheus really isn't going to do much for you. That's where we would do something of a clear and brilliant or a Fraxel or an erbium or a CO2, depending on what that concern is. So, but I think having gone through this conversation, the one thing you should take away is there are so many lasers on the market, especially for your concerns. There's a lot of concerns people have: scarring, tone, color, texture, skin laxity, volume. There are treatments for everything, but that's where you need to go to a provider and they can tell you what you need to do for your color and tone. They can tell you what to do for volume. They can tell you what to do for skin laxity. And they should give you a treatment plan on how to get the best results possible. So that's what we do with our patients. We really care about you guys. We really want you to see results. So we're not going to sell you a laser that's not going to do anything because that is absolutely pointless. You're doing lasers to get results and to get that anti-aging. So if you really are curious to see what lasers would be perfect for your skin, do a consult with Dr. Emer or me, one of the treatment coordinators. We can really help you guide you and help you understand what you can be doing for your skin. All right. So I think I've talked about a lot, and I think I've been giving you guys a lot to think about. But if you do have any more questions, please feel free to DM us here on Instagram. Feel free to set up a consultation with either Dr. Emer or one of the treatment coordinators. Feel free to set up a consult with one of our skincare specialists. You can go to our website to set that up if you want, or if you just don't know where to go, just DM us here and we can kind of send you in the right direction. But keep looking forward. My next live is going to be on Friday at 4 p.m. at the end of the week. So I'll celebrate the weekend with you guys and I'll answer more of your questions. All right, please stay safe out there, wear those masks, and I will see you on Friday.